having contractions.
Oh no! Here, welcome. Here, sit down. Hi, how's it going? My name is Victor. I'll be your nurse today.
Okay.
Can you tell me when you started having contractions?
Like 4:30 in the morning.
4:30 in the morning? Oh wow, so it's coming up pretty soon, huh? Yeah? All right, I'm just gonna ask you a couple questions. When was your last period? Do you know the first day of your last period?
June 11th of 2019.
June 11th of 2019? Oh, so it's exactly 9 months from now. So
Yeah.
today's your due date.
Yeah.
Okay. All right. So just to start off with, we're just gonna start off giving you some meds. It seems that right now you are a little late to be for your labor, so we're gonna give you some oxytocin. Okay, it's called brand name Pitocin. We're just gonna start giving you 1 to 2 milliunits per minute. Okay, and then here. Is that okay with you?
Mhm.
All right, here we're gonna do this one here, and then once the baby comes out, we're gonna give you this one. It's called ampicillin, and it's basically just a antibiotic to help with any type of sepsis or anything when the baby comes out. Okay.
Okay.
Okay, and then we're gonna put this one here. All right. Okay, perfect. And then that one we're gonna start. We're gonna give you a bolus of 5 million units, and then after that we're gonna do 2.5 to 3 million every 4 hours. Okay. All right. I'm just gonna ask you a couple of questions. How many times have you been pregnant in total, including any miscarriages or abortions?
This is my 5th.
Your 5th? Okay, cool. And how many have you had over 20 weeks?
Including this one, 4.
4? Okay. Did you have a miscarriage or?
Yeah, I had a miscarriage. I lost the baby at 16 weeks.
Oh, okay. Sorry to hear that. Okay, cool. So, now that we are going to induce labor, we're gonna try to check for the fetal heart monitor and also for contractions. Okay? We're gonna put a little device called the external fetal monitor. And give me a second. Let me go get it. Okay? All right. Here I got it. All right. First, I'm just gonna palpate for the back of your baby. Okay, perfect. And this is gonna be the heart one. And then at the top, this is gonna be we're gonna put it right at your fundus, and that's gonna check for the contractions. All right?
Okay.
Okay. And then I'm gonna go get the results. All right, good. Your baby seems healthy. Has an average of 150 beats per minute. The average is between 110 and 160 beats per minute for a baby. And we see a little accelerations, 15 seconds apart, a piece. I mean, so yeah, your baby's gonna be doing good. And then we're just gonna talk about some labor positions. Have you considered doing an epidural or not?
Yes.
Yeah, you want to do an epidural? Okay, that's pretty common nowadays. So basically, epidurals, the biggest and most important thing is that not to sit on your back because it is a needle going inside of your back. So one of the most important ones is that maybe you're sitting down, and then with your legs spread apart, but nothing touching your back. Okay, or we can even do it onto the side. There's a few more, but if you also do want to do a vaginal birth, we can do it just regular, where you're sitting back, or we can even do type of where you're holding onto like a labor assisting device with people on the side helping you. You can either be standing up or you can be crouching down or on a medicine ball. Okay.
Okay.
Sweet. And I think that is it. Do you have any questions? No? All right. Perfect. Thank you. Hey, how's it going? My name's Victor. I'll be your nurse today. Can I just get your full name and date of birth, please?
Yeah, Alondra Robledo, May 1997.
Cool. Let's check your wristband. Awesome. All right, hon. We're just gonna do a quick little fundal check. I'm just gonna make sure where your uterus is and how it is contracting. After since you already had your baby. Okay.
Okay.
Give me a second. I'm just gonna press down right here. Okay, it's nice and hard, and it's like 3 inches under Okay, a little over the belly button. Perfect. So that means that it is getting smaller, and so bleeding is going to get a lot less. And speaking of bleeding, have you been bleeding a lot? Can you tell me? Have you?
Yeah,
Anything?
I've been bleeding like some bright red.
Oh, okay. And then I just want to ask you real quick. When was the last time you went to the bathroom?
Like an hour ago.
An hour ago? Okay, that's not too bad. All right. Okay. Well, I'm just gonna check your pad real quick to see how the drainage is, and I'm just gonna zero this out. Okay. And then put a new pad on here. See, K0, perfect. And then, can I see the pad that you have right now, please? Okay, cool. Let me put on some gloves. Okay. All right. We have 4 grams, which is equivalent to 4 mLs of blood. It's not too bad. That means it's getting a lot better. Okay. Cool. And then just to help it a little, we're gonna give you a little drug. It's called Methergin, and it's gonna help you stop the bleeding a little faster than it regular will. Is that be okay with you? Yeah. All right. And then just a quick question. Have you ever had any history of hypertension or anything?
No.
No. Okay. Cool. And then I'm just gonna check your blood pressure real quick. Cool. Perfect. 110/62. Great. All right, and then we're gonna do it on your leg since you had an epidural. All right, so it won't hurt as much because this usually hurts. And then, all right, ready? Give me a second. Okay, I'm just gonna do a little alcohol swab. Okay, you're not gonna feel a thing, okay? Perfect. All right. Put this in the sharps, aka my pocket. And all right. Lastly, we're just gonna talk about breastfeeding positions. We know we just recently had a baby, and just to review a couple with yours. Okay, the most common one, especially since you had a regular vaginal birth, is the cross cradle. And if you want to bring your baby, yeah, perfect. Okay, cool. And so what we recommend is putting a pillow under the baby, and then you just put it, choose the side, yeah, and then we're gonna put a pillow under, and then that's cross cradle, okay? And then the next one I'm gonna show you is gonna be the football one, all right?
Okay.
So the football one is basically you're gonna put your hand under your baby's head, and it's gonna go under your armpit. Perfect, yeah. And then same thing.
Okay.
All right. And then the last one, I can just kind of tell you about it, but it's your side laying position, okay? Which is basically when you're turning to the side, when you're laying down flat, you can turn to your side. And remember, every single time you're doing one of these positions, it's belly to belly contact, because just if you think about it, it'd be really hard to swallow or eat anything if your neck is turned, okay? So you always want to have the ears, shoulder, and feet straight in a straight line, okay? And then belly to belly contact, and then you can do that laying down too as well. And okay, sweet. And did you have any questions today? No?
Yeah.
All right, cool. We'll be around to check for you, okay?
Start.
Oh, okay, I'm sorry.
Hi, how's it going? My name is Victor. I'll be your nurse today.
Hi.
And
I'm
your name
Kelsey.
is? Hi, Kelsey.
Hi.
And your baby's name is?
Sophia.
Sophia. Hi, Sophia. Nice to meet you. Just gonna wash my hands. All right. Your baby looks really healthy. I'm just gonna suction her mouth, okay? I'm
Okay.
gonna do her mouth first, and then her nostrils. Perfect. There it is. And I'm just gonna wash this. Okay, I'm gonna check your baby's vital signs. I'm first gonna do the her axillary armpit for 1 minute. Okay, we're looking at 98.8. Good. And then I'm gonna check her respirations. And then, okay, cool. So 40 a minute, or 50 a minute, sorry, looking good for a newborn baby. I'm gonna just check breath sounds now that I'm here. Check them in the back, sides. Okay, and then we're gonna do Breath sounds clear all throughout. Apical pulse. Alright, cool. 100 and... Oh, okay. Oops. We're going to do it here in the apical pulse. 120 a minute. Nice. And... okay, cool. And then I'm going to weigh your baby.
Okay.
I'm going to just put it... I'm going to zero out. Okay, 7.5 pounds. Your baby's really healthy.
Yay.
Yeah. And then we're gonna check the circumference of your baby's head, okay?
Okay.
We kind of run out of the regular one, so we're gonna use this big one.
Okay.
Alright, cool. Okay, so, we got 35 centimeters, and we're gonna check here. We got 32 centimeters. Perfect. Your baby has really good proportions.
Good.
Alright, and then we're just gonna do a quick little assessment on your baby.
Okay.
And then just going, the head feels good, tender. The eyes are straight with the ears, so they're not lower. You have clear respiratory, nothing weird. We're just gonna check all the joints now. Okay. And then I'm gonna move. Okay, sweet. And they all look symmetrical. Alright, and then while I'm here, I'm gonna check the genitalia. Alright, good. And then I'm gonna turn your baby over. I'm gonna check for grasps. Awesome. Oh, your baby's so cute.
Oh, thank you.
What's her name again?
Sophia.
Sophia.
Mhm. She's my first.
Oh,
So it's
that's
exciting.
awesome. Yeah, I'm sure it's nerve-wracking too.
Mm-hmm.
Alright, the spine looks aligned. Gluteal folds look good. There's no abrasions, no bleeding anywhere. And then, sweet, okay. And then we're gonna give her a couple shots, alright?
Okay.
We're gonna first give starting with erythromycin in the eyes, just to prevent any type of bacteria, specifically gonorrhea, from entering the eyes, okay?
Okay.
So first and foremost, I'm just gonna clean them from inner to outer. And of course I have gloves on,
Yes.
And then put some gloves on, and then we're just gonna open up her eyes, putting from the thumbs on the outer folds, and then opening it, and then I'm not going to put it on the pupil, I'm just going to put it in the outer side of the sclera. Okay, then I'm going to close it and rub it around a little for 1 minute, and then I'm going to take off the excess. Alright, and make sure, holding the inner canthus, make sure nothing goes in, and then I'm going to do the same thing for the outer side. Boom. Close it. I'm gonna rub it around a little for 1 minute. Awesome. Holding the inner canthus, and then I'm gonna take off the any type of extra. And then next we're gonna give vitamin K. Vitamin K. Vitamin K. We're gonna give to just encourage any type of clotting and not to have any type of like bleeding that might happen.
Okay.
It's not common, it's just prophylactic, just to prevent any type of mishaps or anything, okay?
Okay.
Alright, so we're just gonna give it on the thigh. Okay. Ready? Do you want to hold her or something?
Yeah,
while we give her?
just so she doesn't cry.
Okay. Alright. Oh, you're so cute. Alright. Oh, you're so cute. Wow, she did really good. No crying. It's like 1 in 5. Alright, and now we're going to do one more shot, and this is for Hep B. This is same thing, it's just prophylactic. And we're going to do a series of these, and this is the first one. And in a month or two, come back for the second shot, and then maybe in 6 to 8 months, we're going to do a third. We'll just do this one, maybe on the other thing. If you want to distract your little... Hey!
Oh, it's okay. Oh, mama's girl.
Yep, that's it.
Okay.
Awesome.
Oh, didn't even cry.
Yeah.
Wasn't too bad.
Cool. And then we're gonna do when your baby's born, we're just gonna dry her off, like pad dryer. Take off all any type of mucus or anything that she might have, and then make sure that she's warm. And sometimes we can even put a little hat on.
Okay.
Okay, just to prevent any type of like body heat to leave, which is really common in babies. Okay.
Okay.
And then oh no, is she breathing?
Oh no, oh no.
What? Oh no, she stopped breathing. So I need to do assessment. Alright, we're just gonna have to apply some positive air pressure, okay? Oops. Here's the mask. We're gonna do 60 per minute. 1, 2, 4, 5, 6, 8, 9, 60.
Is she okay? Is she okay?
Oh, she came back. She's breathing again.
Oh, good. Whew.
Oh,
That was so scary.
I was so worried, Sophia. Awesome. And then we're gonna do some chest compressions. And then I'm gonna get a little bag for her mouth. And we're gonna do a ratio of 30 here to 2 puffs. 1, 2, 3. 30, 1, 2, 1, 2, 3. 30, 1, 2. And that's it.
Yay! That was good. That was better than mine.